Hey y'all, it's Mystic with Mystic Moments. Today we're going to talk about your patients as a nurse who are having a STEMI, NSTEMI, MI, myocardial infarction, cardiac event, coronary artery syndrome, whatever label you'd like to put on it. They're having heart problems. Do you understand your patient? Do you understand what your patient's telling you and what the plan of care should be, or what road it's going to go down? So let's get into it. You're at your facility, you get your patient, whatever environment you're in, they're having chest pain. Chest pain can mean a lot of things, but because we go from most lethal to manageable in healthcare, then you start with the heart, because that's how you wake up dead, is your heart quits beating. We don't want that for our patients, so we start with the heart and we rule it out. So ABCs, airway, breathing, circulation. Your heart's a big part of that. So when you get to the bedside and your patient's having chest pain, it's important to talk to them. Whether they want to talk to you or not, you got to get some information from your patient. In order to get a better idea of what road you're going to go down to treat your patient and get them back on their feet and feeling better, they've got to tell you what happened when they started having this pain, what their symptoms were, how they knew to access the healthcare system, if they were sent by somebody else, what brought them there. That is important because a lot of times in our society, heart attacks are silent. And sometimes people don't know when they have them. Now, sometimes it's easy and they have this huge crushing chest pain, and it's easy for you to look at a patient, they're gray, they obviously aren't circulating much blood, or they'd be a little pinker than that. So they're having an interruption in their pump, and you see by looking at the patient, they're diaphoretic, they're throwing up, they're obviously not perfusing with their pump, their heart, the way they should. So that automatically puts your mind in oh Lord, let me get to looking at their heart. So you get your EKG off the bat, you put them on the cardiac monitor, you get your vital signs, and your vital signs are vital for a reason. They're going to tell you a lot. Do they have a blood pressure? What's their heart rate? If their heart rate's 150 and they don't have a blood pressure, that's a problem. You got to fix that first. If their heart rate's 30 and they don't have much of blood pressure, you got a problem. You got to fix that. Their heart's got to beat faster than that. So depending on those symptoms, once you get into studying hearts a little more, you're going to understand that the symptoms are going to tell you what part of the heart might have been affected. If you're not good enough to read EKGs yet, or you haven't learned that skill yet, that's fine. It's a skill that'll come with time if you really love hearts and you're interested in it. So look at your patient, understand, oh my God, this is what's going to go on. So now we know something's wrong with the pump. They're not perfusing. You've talked to your patient. They either had pain or didn't have pain. It got better when they rested or it didn't. Those are all going to tell you things about what kind of pump problem's going on. Are they breathing well? Is it hard to breathe? Are they throwing up? That information will come back to you, and as you share it with your team, I would encourage you to talk with your providers and the other people in your team so that you can better understand what you're seeing. Those episodes and those patients that you take care of that are in the middle of that cardiac event, those are some of the best lessons you can learn as a nurse. When you can look at that patient, understand everything you've done, even if it's retrospectively, and go back and understand what your interventions did that improved that patient's status, made them feel better, or made them worse, then you're going to understand the physiology and anatomy of the heart that's going to take you back to the event that caused them to access your care and what you did to impact their care. So I work in the emergency room. When we get somebody in that we think may be having a heart attack, the first thing we do is get an EKG, because an EKG is a snapshot of the function of your heart. It tells us how the electricity is moving through your heart and how much force it takes electrical wise to push that electrical charge through the muscle. So you get how many complexes you have on an EKG over time versus how much force it takes to push that electrical current through the muscle And that tells us how healthy the muscle is. So if you see an EKG that has these big, huge tombstones in it, and if you've never seen one, you can visit our website. There will be some tools up soon about EKG snapshots, but that's another video too. You see these big, huge tombstones, that means that the electricity is having to push really, really hard because something's happening to that muscle, and it's just like a bumpy road. You have to really get down and drive careful over those bumpy roads because it's hazardous. So that's what the muscle is doing to that electrical current when people are having a cardiac event. That's why ST elevation is a bad thing. It means the roads are torn up. It means the muscle's torn up. Something is wrong. So the best way we can to fix that problem is what we call revascularization. And that's a cath. You get to go to the cath lab. And they put a little tool in an artery. They go up into your aorta, right at the coronary sinuses. Then they go into your heart, the vessels in your heart, and they take a camera and they look at what's inside those vessels. So when they can look and visualize the inside of that vessel, they can see whether it's occluded, whether it's stopped up, or it's clamped down. They have all kinds of tools and lasers and fancy things. They can go in there and clean it out or stent it or say, oh, this is a wreck, we need to just do a bypass. And if they need to do that, then the patient has their next step in the care. That's how they decide where they're going to go next. Once they see the problem, then they can go in, or they can make a plan about how to fix it or how to route around it. So all of this to say that your cardiac patients need immediate intervention. If they're having a STEMI, an NSTEMI, doesn't matter, they're going to need some intervention, which means they're going to need a procedure. Don't feed them. Make sure they have a good IV access, because if you need to give them drugs, you need to give it to them quickly. There's not time to start an IV 2 hours after you've had a cardiac patient and you've known that they may need intervention. Get your IV in quickly. Get your blood work done on time so that patient can get in front of whatever provider can do the intervention that they need to save their life. If you are serving around common sense, then you are going to set the path for all of your cardiac patients to get to the next step in their care as quickly as possible. So it won't be your fault if they can't go to the cath lab because they don't have an IV, or they've eaten a hamburger while they were waiting on their troponin to result. No, they can't have anything to eat. Tell them why they can't have anything to eat. Make sure they understand that you're not after them being uncomfortable and starving to death. You're after them making an investment in their health care so that they're eligible and able to get the next step in a timely manner where it won't negatively impact their life for the long run. So, serving around common sense, do no harm and take no shit. And that means from the cath lab too. So if you're sending your patient to the next step and somebody wants to ask you 9,000 questions and be petty, you've done your job, you've taken all of the steps in your scope, then it's okay to tell the next person, this is what I've done, this is what I know, and I'm so glad you're there to take over from this step forward. Have a nice day. You don't have to listen to them sit there and tell you what you did and didn't do and all that. Now, if there's a learning opportunity, take it. But at the end of the day, if you've served around common sense, you've done no harm, you don't have to take the shit. And you learn from your mistakes. If you make it. Have a great day, y'all.